Of course, there's also the medical response to the pandemic. For a discussion on that and a look into the future, I'm joined by two physicians. Dr. Jennifer Kwan is a family physician in Burlington, Ontario, and Dr. Alon Vaisman is an infectious prevention and control specialist in Toronto. Thank you both for taking the time. Dr. Vaisman, I'll start with you. How has Canada's response been so far in your eyes?
I think things are going fairly well, all things considered in terms of the acute care side of things. We're seeing that there is, of course, a surge of cases, but the surge of cases, generally speaking, in most acute care sites across the country have not been to the overwhelming extent that have been observed in other parts of the world, including in New York or in Spain or in Italy, such that they can manage the increase in the inpatients and then patients requiring intensive care management. Of course, a big area of concern that continues to be highlighted by many people is the management of long-term care facilities. So that's going to be something that needs to be require ongoing attention in order to continue to try to manage those patients and prevent outbreaks.
Dr. Kwan?
I think Canada is also doing relatively well compared to other countries. Looking back, there's always, questions of when things could have been implemented, and I think it's important to understand the government has to balance the medical as well as the economic sides of things. So it looks like our numbers are not as bad as some modelings or prediction, which means that we are doing a great job and that everyone's contributing by staying at home, which is very important.
And Dr. Kwan, what kinds of challenges are you facing treating patients at your clinic?
So currently, most family physicians are doing things by phone or by virtual care. 95% of things can be managed over the phone. However, we have to still see people in person for urgent cases, immunize babies, and provide prenatal, antenatal care. So anytime we see a patient, there is still a risk that they can be an asymptomatic cure. So we have had to implement a lot of new protocols to ensure the safety of ourselves, our staff, and our patients.
And Dr. Kwan, I understand you told our producer that you're having trouble getting personal protective equipment, right? You have an order that you put in. Can you just tell us a little bit about that?
Yeah, so it's been maybe a couple months ago, we placed an order with our usual supplier for PPE for masks. However, it still has not arrived yet. However, we have been able to access PPE from other sources, our contacts, and some of our colleagues who are generously sharing amongst different clinics. So we're hoping that this will continue to be sustained, that we will be protected while providing care for our patients.
And Dr. Vaisman, can you tell us a little bit about how the research is being shared about the disease, is being shared between doctors and health officials? How's that working?
So there's several repositories of information where people can share the newest evidence, a lot of social media sharing as well between physicians. Within universities, there's been setups of various groups that are coming together to scour the internet, scour the literature to figure out what's been established, what's currently ongoing in terms of research as well. And with each academic center as well, there's organization regarding how research is going to be done, so to make sure that there isn't overlap or duplication of work, and also to make sure that the research that we are doing is ethical and it is also well-founded in science.
And then, Dr. Kwan, what about those patients that are just not getting the non-emergency procedures right now, like surgeries or regular checkups? They're all being postponed. That can be problematic for people, right?
And that is definitely a major concern for us. Right now, everyone's focus is on the acute management of COVID cases. However, there's a number of issues that can occur long-term that will affect patient care. So, for example, right now, if people have chest pain, normally they would go straight to the hospital. However, I do get patients letting me know they had chest pain yesterday, it was severe, and they didn't go to the hospital because they were worried about getting COVID. So if anyone out there thinks they're having a medical emergency, you still need to contact the emergency authorities. The second thing, as you mentioned, is if procedures, elective surgeries, or kind of less urgent cases are being postponed right now, there will be a backlog, and the wait times, unfortunately, will be increased for seeing a specialist, for having surgeries and procedures. And right now, I think there are a lot of clinics that are facing trouble with decreased volume, and they still have to pay for their overhead and support their practice, pay their staff, and things like that.
Yeah, I mean, there are just so many elements to all this. So, Dr. Vaisman, let's look ahead now. What challenges do you think are still ahead of us?
I think on the acute care side, so the challenges is, again, to meet that demand for the inpatient admissions, as well as the higher level of care that's required in intensive care units. As I mentioned, currently they're able to manage in most places, but we need to be able to continue having the resources available in the event that there is another higher wave of patients that comes in. So maintaining the supplies across the board, including medication, including the ventilators, including all the personnel available as well. On top of that, there's the big issue of sustaining our PPE supply. So this is going to be more like a marathon than it will be like a sprint. So we need to make sure that our PPE is well sourced and that we're using it rationally so that we can protect all the healthcare workers for a longer period of time. And those are the major issues that we're going to face on the acute care side of things.
Dr. Kwan, looking ahead, what are some of the key challenges?
I think, as we mentioned, the patient care for long-term managing chronic illnesses is going to be a major issue, and I do foresee that there will be some permanent changes to medicine in Canada. So, for example, I think there will be an ongoing move towards virtual care telephone management, as if the virus is still going to be present for a year or two, we still will have to provide care for our diabetic patients, for people with long-term illnesses. So ensuring that the virtual care platforms are sustainable is very important to ensure quality patient care.
I appreciate both of you taking the time in what must be busy days. Appreciate this. Thank you. That was Dr. Jennifer Kwan in Burlington, Ontario, and Dr. Alon Vaisman in Toronto. And CBC News has continuing coverage of the COVID-19 pandemic here at home and around the world.